Hello, everybody. I'm sorry to keep you all waiting. I think Erica has, I know that you have run through the discussions that we've been having here, and we think we've reached an agreement on the childcare piece, recognizing that it's not what we would all want, but hopefully it can help in the short term as we go into the new year with the new administration. And I'm delayed because we are voting today on the defense bill, and there's also, we need to pass a continuing resolution to give us another week to get the rest of the government funding piece done. And there are a couple of people holding that up, basically, is the challenge. And so we're continuing to negotiate around providing COVID relief. And at the same time, we've got an effort by a couple of people on the other side of the aisle to try and shut down the government, I fear. So hopefully that will get worked out, and we can continue to work on funding the rest of government with an omnibus for next week. So that's kind of where we are in the context of what's happening here in Washington, trying to get a response that will really help address the challenges that I know you all see every day as you're looking at families who are worried about losing their unemployment, how they're going to feed their kids, pay their bills, people who are getting evicted from housing, and worried about who's going to take care of their kids. So I really wanted to hear from all of you what you're seeing on the ground, and hopefully we can get this agreement that we've reached around the child care funding that will be helpful for the next few months. So let me stop with that. As you can see, things are really in flux here in DC, and I wish I had the answers to what's going to happen at the end of the day and next week. But Senator Hassan and I are continuing to try and get an agreement that's going to provide relief to people who need help. So let me ask if everybody could, if we could go around the Zoom and folks could just tell me who everyone is. And I know many of you, but there are a couple of people on I don't think I know, so that would be helpful.
Hi, Senator. I'm happy to read through a list of who we have on the call along with
That would be great.
Perfect. So we have Tracy Pond, the program manager with Child Care Aware of New Hampshire. Karen Thomas, assistant director at the Tri-County CAP Head Start. Chris Emmond, the executive director at the Boys and Girls Club of Central New Hampshire. Ann Auger, the coordinator at the COAS Child Care Director Network. Ann Grassi, she's with Rochester Child Care Center and also representing the New Hampshire Child Care Advisory Council.
Right.
We have Mary Lou Beaver, who is the director of the Children's Place and Parent Education Center at Waypoint. We have Jackie Cowell, the executive director of Early Learning New Hampshire. David Ports, the CEO of the Granite YMCA. And we have Rebecca Wojtkowski, the Kids Count Policy Coordinator at New Futures. And we do have a number of press on the line as well. We have folks from WMUR, WBZ, the Union Leader, Seacoast Online, the Caledonian Record, the Berlin Sun, the Laconian Sun, and the Salmon Press.
Good, and I think you may have missed Chris D'Alessandro.
Oh, and I'm so sorry about that. Christina, thank you so much for joining us. Christina, as you know, Senator, is with Moms Rising New Hampshire.
I do. Well, thank you all very much for taking time. And again, I apologize for being late. As you can tell, today is kind of a crazy day as we're trying to get a number of things sorted out. So I really appreciate the opportunity to hear from each of you, and for all of those reporters who are on the call. As I'm sure you all know, childcare is critical. And if we're going to get our economy moving again, if we're going to be able to put people back to work, we've got to ensure that they have a safe place for their children. And that's the focus of everybody who's on this call, trying to make sure that that happens and that families can depend on a safe place for their kids. So I look forward to hearing what each of you have to say. And I don't know, Madison, where you would like to start. If it's with Tracy or Ann or Jackie.
We can go ahead and start with Tracy Pond with Child
Great.
Care Aware of New Hampshire.
Good afternoon, Senator.
Hi, Tracy.
So I'm a Child Care Aware of New Hampshire is a program of Southern New Hampshire services, and we provide a lot of different services to families and to providers. What we're hearing from families themselves is that they're having a hard time in terms of affording childcare, especially when programs are closing. We've got some programs that may be closing a classroom, some programs that may be closing altogether. You know, as we know, we're seeing an increase in numbers. We're also starting to see, you know, where staff may have been exposed or a family in the program may have been exposed, and that's impacting the program as well. Many programs are struggling to pay the bills due to lack of enrollment. A lot of the directors are concerned about their staff, their resiliency, self-care, and then just hiring. So in some cases, they may not even have a classroom being able to be open because they can't find staff to fill it, and other aspects of that. There's also the concern about the social emotional well-being of the children, you know, during these times, and then also after. So I guess post-COVID. And then many directors that we have now, I mean, before, you know, they'd be able to work in the office, you know, if they had the luxury of doing so. Now we have a lot of working directors as well. There was a recent, I was going to send this to Chris and Madison, that came out from the National Association for the Education of Young Children, in terms of child care providers, you know, and how they're sacrificing to stay open and waiting for that relief. So from that, there was 54 responses from the state of New Hampshire for that. 91% were from child care centers. 9% were from family child care homes. 66% of those respondents said that they are currently losing money by remaining open, even as they are trying desperately to stay open for the children and families they serve. 74% of respondents reported putting supplies or other items on their personal credit card or dipping into their personal savings account, including 80% of child care centers. 85% of respondents are paying additional costs for cleaning supplies. 57% are paying additional costs for PPE, and 79% are paying additional costs for staff personnel, including 83% of child care centers. Thank you, Christina. 43% are confronting a great deal of uncertainty that they are unable to say how much longer they will be able to even stay open, which we know that's going to impact what we have available.
Tracy, can I just ask a question? So did NAEYC survey all of the child care centers in New Hampshire, or was it a particular list?
I know that it went out. I know, Christina, you were sending it out as well. We were trying to get it out to the field. We are seeing a significant reduction in the number of programs being able to respond to surveys too. They just don't have the time to as well. But it did go out on numerous organizations throughout the state to have that feedback.
Yeah, and I would just say, Senator Shaheen, our responses were consistent with other states. I do think there is some fatigue, and the field is really stretched right now.
Do we have that summary anywhere? And if so, could you share that with us?
Mm-hmm. Yes. Mm-hmm.
That'd be great. Thank you.
Thank you, Tracy.
You're welcome. Thank you.
And next we have Karen Thomas with the Tri-County CAP Head Start. Karen does have to leave us a few minutes early, so I want to make sure we hear from her.
Great. We're not seeing Karen on the screen. Do we know if is she on the phone?
I will follow up with her. She did have to leave a few minutes early, so I will follow up with her. She had to jump, but we will get her updates and make sure that we have them. Next, we will go to Chris Emmond with the Boys and Girls Club of Central New Hampshire.
Hi, Chris.
How you doing, Senator? Thank you. First of all, thank you for the support that you've already provided, the PPP loans and the COVID relief package that we've already kind of all benefited from. Really, it kept many of us alive, whether you were a large program or small. It was critical. And I foresee for many of us, the first 6 months of 2021 are going to be equally as challenging, but it sounds like there is great news on that front. I guess the only points I'd like to make.
We have to get it passed first. Let me just, that's a big
I'm not trying
caveat,
to be
but
optimistic. I think you'll pass it. I think people will get their act together down there. But Tracy did a great job talking about some of the needs. I mean, for us, I'm looking to the future. A lot of workforce development issues. We're all struggling for staff. We were struggling for staff before COVID. Part of it is a pay issue. I know that can't all be resolved by Congress, but helping with the workforce development and the development of the up-and-comers, and perhaps putting some money towards those efforts in the future would be very beneficial for us, because many of these people just graduate with just enormous bills like other majors, and they can't afford to work here. The other thing that is going to be necessary, many of the families are going to be economically disadvantaged for quite some time. I think after this, they may get back to work, get their hours back, but the scholarships and the support that families are going to need is going to be fairly long lasting. So when the economy gets back and people are, we're back to quote unquote normal, I think many of our families are still going to be struggling, and we don't want that to be forgotten about. And I would say the final point would be, I think even with us, I said the first 6 months are critical because you may lose some people, some programs the first 6 months is that bad. But once we get past that point, and there's still going to be a lag effect due to this. This has been so traumatic for a lot of people. Some people may be reluctant to send their kids back. Some people, it may take them longer to go back to work and to go back. So I would just caution on that as well, is there may be, let's look a year from now, there may be this image of things are back to normal. And I think you may still hear from many of us that there are still some struggles that have continued. And it's just one of those, we want to be prepared ahead of time, because any legislation, as we all know, takes time to get through. But again, thank you for your support with all of this.
well, thanks, Chris. I'm sure probably most of you know that Patty Murray has a bill that would provide $50 billion for childcare around the country, and it deals with some of those other issues as well that you're mentioning. And even the Heritage Foundation has pointed out that we need $25 billion to address childcare in America. So those are probably, when that conservative organization acknowledges this need, hopefully that message is going to get through. We started at a higher number than 10 billion on our bipartisan proposal, but it is only going to cover the period from January 1st to April 30th. So we think hopefully it can help tide people over for the next few months until the new administration. And I know back in the summer when we were up in Claremont meeting with some folks, Jackie, you were there, and one of the things that you said that day really resonated with me when you said, if we don't do anything, we're going to lose half of the child care centers in New Hampshire. And that is a dramatic outcome that we don't want to happen. And it's something that I've been pointing out as I've been arguing that we need to look at how much we can do to support childcare, because we can't have that happen to all of the families, all of the kids who are in need in New Hampshire. So I think what you say is correct, and we need to continue to argue that this is not going to be something that's going to get fixed overnight.
Thank you, Senator.
Thank you, Chris. Senator, we do have Karen with us. She's having some tech difficulties.
Oh, good.
But if we can unmute her on our end and see if that works, and if not, we'll follow up with her offline.
Okay, great. I'm not the operator here, so Sarah,
yeah, I'm trying.
Is she unmuted?
I'm trying, but not quite having success here. I'm sending her a request to unmute, so sorry.
Well, Karen, we can circle right back to you if we're able to sort out the tech difficulties. And in the meantime, we can go to Christina D'Alessandro with Moms Rising New Hampshire.
Hi, once again, hello, Senator.
Hi, Chris.
Thank you really for all the work I think you've been doing on behalf of providers and families. You know, we really are certainly hearing that, and I and we're really just trying to make sure we're giving you all the best information that we can
Good.
get from on the ground. Two things I wanted to point out is, well, we really are hoping that the 10 billion will go through, and that's going to provide some great relief to providers. I'm a little concerned, just speaking for the families, that with the lack of paid family and medical leave, that we're going to have a gap. And the 10 billion is really going to be covering, I think, a lot of basic provider costs. So things like co-pays that families have been paying out of pocket might not be a part of that. So I'm really encouraged to hear that you're sort of equally seeing this as a down payment on a broader change, because I do think, if anything, we've learned from COVID is that childcare is such an essential part of the workforce, and it's been existing in this fragile state for so long. And I think want to just highlight the fact that parents and providers are united in saying, let's really think of how we can do this differently over the long term. And obviously the other key issue for parents is the extension of the unemployment insurance. Because I do think a lot of families are struggling balancing that remote learning and balancing getting their kids back in childcare. So I'm obviously hoping that comes out, but really encouraged to hear that there is that bipartisan agreement on childcare. And I hope that looking forward, it continues to be the bipartisan issue and receive that support that we know it should. So
Yeah,
thank
me
you.
too. And the package that we're working on is 908 billion. As I said, it's for a 4-month period, and it's a bipartisan group that's in both the House and the Senate. And it would include unemployment benefits, not at the $600 a week level. It would be $300 a week, because this is a compromise, but it would be critical for, I think we're going to have about 12 million people who are going to lose their unemployment at the end of the month. So that is absolutely critical. It also includes additional funds to help food, an increase in the SNAP benefit, support for food banks and other food programs. And that will also be very important, as well as support for housing. I know that rental assistance is a huge challenge, and the CAPs have really stepped up to provide help in distributing those dollars that the governor set aside through the 1.25 billion, and that's been very important. Our legislation also would extend all of the deadlines in the CARES package in a way that would allow that money to continue to go out through the program that's been set up to help with housing assistance. And the legislation also includes some additional money for homelessness. So again, it's not a package that I would have written myself. It's a compromise, but it includes some critical pieces that are going to be really important to families. And I appreciate your saying that this is a long-term challenge.
Thank you, Christina. Karen Sender is going to send her updates via email.
Oh, I'm sorry, Karen, that we weren't able to hear from you directly.
And next we'll go to Ann Grassi with the Rochester Child Care Center, and also representing the New Hampshire Child Care Advisory Council.
Good morning, Senator. Good afternoon, Senator. Thank you
Yes,
so
that's
much.
right. Only feels like morning.
It does. The day never ends.
Right.
I just want to say thank you so much for everything you're doing, and we do know that you're on our side. And this is more than just a just now problem. The Child Care Advisory Council has been, one of the positives out of all of this is that our virtual meetings get much more attendance. And we've had close to 100 providers that show up to our virtual meetings and are very willing to share what they're going through and that we ask them polls all the time, you know, and most of them are only half enrolled, and they're losing tremendous amounts of money every month just trying to stay open. They are worried about the Families First leave that their staff have had to start using, and without being impacted by COVID themselves, you know, they're just waiting for testing, or they might have some symptoms, they have to stay home. It's going to run out before too long, and they're going to have nothing, which will really impact the centers, which already are understaffed. We cannot find people that we can hire. And I'm really worried going forward about our school age population as well. A lot of school age programs have closed. kids are being impacted by this, doing virtual learning, being at home, being on screens. I think when we're done and back to school, it's going to take a tremendous amount of people to support those kids, and our after-school programs are going to need a lot more support than they've had. Which brings us to the reality that childcare in this country is a public good, and it needs to be recognized and subsidized. The parents can't afford it, and we too long have subsidized it with the wages of our staff that are not good. We need to continue fighting after this is over. Yeah, this is an opportunity that points to the seriousness of the world of childcare and how fragile it is. Christina did a great job saying how fragile. We've been on the edge for a long time. I've been in this business a very long time. And you've been right there too, Senator Shaheen. You've been always involved with childcare centers in New Hampshire and helped every step of the way. But it's become a bigger than New Hampshire problem, I think, and we just need to use this as an opportunity to keep it in the forefront of everyone's minds. But let us know. We really want the Child Care Advisory Council members yesterday want you to know that any kind of data or information you need, we will gather for you. I did a brief little in the chat, about 13 directors told me how many staff have used the Families First Leave already. And if you need those kind of numbers,
That would be really helpful to get that kind of information.
we can gather that for you, because I know it's ammunition that you could use.
Right.
So, and anything else that you think of that could be good for your arguments, don't hesitate to reach out to us.
And can you talk, or maybe others can do this as well, about the impact? There have been two impacts, as I understand, on child care centers. Once they opened again, the challenge was not just getting them open and staffing and all of that, but it's also because of COVID, the reduced number of kids that can be taken care of in any given location. And how do you split that out versus the reluctance of families to send their kids back versus the cost? Do we have any sense of what all of those are barriers,
Well,
and I understand that, but do we have any sense of what the biggest challenge is there?
It's ever changing. It's like you're on quicksand every day. Our first two exposures were not from within our programs, but from community spread. And you learn very quickly how that affects your daily operations. And you put in what you think are good practices for protection of everybody, including children and families. And before you know it, there's got to be a change within that too. It's very hard for childcare people who want to be warm and fuzzy to be masked up all day. And it's hard for the children. It's really a struggle, and you never feel like you're doing it right. You never feel like you're doing it all right. And then it seems like there's no one listening to the issues of, we quickly have discovered we're losing $40,000 a month just by staying open. And that can only last so long. Licensing gives us good numbers on closures. It's getting to the scary point. I think after the holidays, a lot more tough decisions are going to have to be made about balancing that. You aren't getting all of your kids back. Some toddlers who could come back have older siblings who have to be watched at home to do virtual learning. If we can get our schools back, I'm also on the school board here in Rochester, so I know that end of the family struggles as well. It's like balancing on one foot and throwing 10 balls in the air and trying to keep them all up.
Yeah, and I appreciate that women in particular have been hit hard because of the remote learning and kids at home and trying to work from home. It's really taken a toll on families. I appreciate that.
Yep, it's tough all the way around. The vaccine is, the hope for vaccine when we can get people back to school and teachers protected, I think is going to go a long way to helping.
It is. I agree. We can't get that out soon enough. But part of that also is helping people I know there are some people who are skeptical of taking the vaccine, and so I hope that one of the things that I spoke with the Department of Health and Human Services in the state as they were talking about vaccine distribution, because part of what we've got to do is to message safety of the vaccine and how any challenges that families might have in taking them.
I agree. I agree. We feed our kids hot dogs. We don't know what's in those hot dogs. I'm not too worried about a vaccine that's been through the vetting process it's been through.
Yeah, hot dogs aren't approved by FDA.
Thank you, Anne. Next, we have Jackie Cowell, the Executive Director of Early Learning New Hampshire.
How do you do? Hi. I've got a quick question, if I may. You mentioned that this bipartisan stimulus bill right now might be an interim step for January through April, a 4-month bridge of sorts. Could it also be used for prior losses? Because what we learned in New Hampshire when more money was going out to keep programs open and survive was that the latest round of money that just went out this month, frankly, $10 million more went out, and the need was shown after getting PPP, after getting the first round, after getting this round. There was still a gap about 35 million, just with about 250 programs, not even the 800 or so programs. So just to be clear, I agree with everything everyone said, but knowing that the need is just so great, even from the past. So I just wanted to point that out.
Well, thank you. I think part of it is trying to get agreement on some of those concerns. And one of the challenges here is that because in the Northeast, we got hit by the coronavirus first in the country. We were some of the first states to be hit. The states in other parts of the country, parts of the Midwest, the South, the West, were later at seeing the virus. And so some of those costs haven't shown up yet. And that's part of the challenge, trying to get data that we can get support for that shows the impact, because we can show it for New Hampshire and, New England, but trying to get people to show it for some of the Western states that got hit so much harder got hit so much later, has been the part of the challenge in trying to get agreement. But I think what you say is absolutely correct. And as we see more and more, we're going to see that at least from some of the economic data that I've seen, the second and third quarters of 2021, first, second, and third, are going to be hit as hard as some of 2020, probably harder in terms of the revenue impact.
Thank you.
Thank you, Jackie. And just as a quick reminder for folks, we have just under 15 minutes left together, a little bit less than that. So if folks could keep their remarks to 2 to 3 minutes, we have a chance to hear from everyone. That would be great. And next we have Ann Auger from the COAS Childcare Directors Network.
Thank you, Madison. I'll try and keep my remarks to 2 to 3 minutes too.
Hello. Thank you for all of your hard work for families and providers. Centers in the North Country are operating with enrollment between about 40 and 60% of normal right now. And even if the demand for spaces are there, centers are really hesitant to accept new children because the availability of staff is uncertain. Staff are in and out of work due to COVID-19 illness or exposure. Many staff work multiple jobs and are exposed to COVID-19 in these second jobs, leading to days out of work due to sickness or recommended self-isolation. Programs are continuing to experience a staff shortage and are trying to keep teachers with specific groups and not mixed classrooms, which is a huge struggle. The hours needed by families are long and too long for any staff to work open to close if we don't want them to get burnt out. So the North Country is just starting to experience a rise in cases that we really haven't seen before. For this reason, centers have entered a closing and reopening phase, which is really affecting their ability to hire and retain staff and to keep enrollment up. Families are afraid of exposure or finding care situations that are more stable. The consequences are that the financial cushion centers were able to build up with the COVID-19 related funding resources is getting used up. The COVID financial resources like the PPP and the CARES Act money that came through state aid, like the CCRSP money and the CCCAS money, has really been instrumental in keeping centers open or able to reopen. Without the extra cash, most of the centers would have closed their doors by now. So the new funding is needed if centers are to get through the next few months of potential COVID-19 disruptions. And then we actually, the Coas County Director, did receive a large sum of money for the NERF. And I just wanted to mention that we'll have to return a lot of that money because of the unrealistic deadline of using it by the end of the month. So that's really unfortunate because we really could have used it in a lot of different ways.
Yeah, I am, and I'm pretty confident that those deadlines are getting extended, however, on using the money by the end of the year. I think those deadlines were put in at a time when we didn't understand how long the pandemic was going to last.
Well, that's good to hear. I really appreciate that. So centers are just starting to use the Family First funds for two reasons. One, they have not known about the funds, so they're really just starting to find out about the program and how it works. And two, centers up north are just beginning to experience positive exposures, which are causing classroom or center closures. So we really need the Family First funding to be extended in 2021 and last for more than just the 2-week time period to account for multiple shutdowns. Along the lines of vaccination, we really need to encourage childcare providers to have access to the vaccine at the same time as public school teachers, optional of course, and increase the availability of free testing. And you know, some other things that people have mentioned just as talking points for today was having a shared database with the state where providers can answer questions about exposure at their centers would be really fantastic. And having a specific contact at the state instead of having to talk to multiple people or multiple entities or agencies. There's been a lot of calling back and forth, and it's really taxing and exhausting. And you know, they're asking questions that they may not have answers to right away, and it would be helpful to have questions ahead of time so that they knew what they needed to answer and they could gather the information they needed.
Is this something that you all have requested that the state provide?
No, I'm just mentioning it now as something.
Since I don't control the state apparatus, it might be helpful for I don't know, Jackie or Ann, maybe one of you could do it through the umbrella organizations, because I can see how that would really be helpful to everybody.
Thank you. A continuation of the COVID-19 absentee billing for scholarship and non-scholarship children that ended on November 29th is really crucial. Centers are seeing a continuing problem since that time with children having to quarantine and therefore not bringing in enough income to pay their staff. One program actually had to close out of precaution to not have anyone else impacted by an exposure. And because they were not told they had to shut down, they were not eligible to bill for those children. And we've also seen an increase in families getting shut off from scholarship billing for really an unknown reason. And they're just trying to figure all of that out. So that's been really hard. And so they're making, really hard decisions about, well, do I let this family stay in and, have a bill that keeps increasing while we wait for hopefully them to get linked with the state system or, and kind of take a loss on it if it doesn't come through. So those are just some things. Really, the bottom line is that we need to provide sufficient financial resources so centers have the money in their bank accounts at the end of this. And we should also do what we can to elevate the status of childcare workers, providing them incentives and recognition for the work they do. We need to do this so centers can hire and retain teaching staff and remove the need for childcare workers to hold second jobs. At the federal level, we need to fully fund childcare for all families in 2021. It needs to be enrollment-based, not attendance-based, to support families as they transition back to work.
Thank you very much.
Thank you, Anne. Next, we have Mary Lou Beaver from the Children's Place and Parent Education Center at Waypoint.
Hi, Mary Lou.
Hi, Senator. I hope you're doing well. Thank you for your continued support as always and for listening to us today. Waypoint acquired the Children's Place and Parent Education Center 1 year ago, as it was struggling to be sustainable. The board of the Children's Place was actually talking about closing, and we put together a plan that both boards, Waypoints and the Children's Place Board, found acceptable. And we are now a program of Waypoint and also a family resource center as well, keeping in mind that our wonderful mother founder, Mary Stewart Guile, and what her vision was for the Children's Place. So I was asked prior to us acquiring the Children's Place to put together a plan for sustainability. And of course, I had this wonderful vision, and then COVID hit. And we were looking at maintaining what the Children's Place had always been, which they refer to it as a drop-in center. I think of it more as respite, offering respite care, part-time care for families and caregivers in need. And also from there, building out and doing a full-time childcare program, 6 days a week, adding Saturdays in. We had plans drawn on renovations we would need to do ahead of time. And then March, we closed our doors. 6 of our staff, there's 6 of us on staff, and 4 of us are high risk, age 60 and older with diabetes or asthma, other things. So we needed to make sure that we were going to be able to keep staff safe and bring them back when it was safe. So we made the decision to close the doors. And all of the staff was put on furlough. We reopened the end of August, but during that time, we had a wonderful donor step up and offered to pay for the renovations that we would need to reopen, meeting CDC guidelines, which also fell into the plans that we had put together on how to take this space and make it into more of a child care and family resource center setting. So I was able with that to get the license capacity moved from 20, double, to 40.
Wow.
However, we are open, and I have 3 beautiful closed classrooms because I can't find staff. We also are, the staffing of the classrooms is a huge issue. My staff is, feeling burnout right now because we don't have the ability to bring in even substitutes to help and cover hours. They need a mental health day. By all means, take it off, but that takes me into the classroom. And losing a day, in my other work and working with the Family Resource Center. My biggest issue is meeting payroll. That's my biggest challenge, is how do I meet payroll? Even, I have to have a teacher in a classroom, even on the days where I only have 2 children. Prior to COVID, we had 37 children enrolled in the program. I have 17 now. And of course, they don't all come all day. So there's some that come just a couple of hours a day. We still do the respite care. We have, and many of those are children who live in grand families. We also have the Kinship Navigator program for the Concord region based here out of the Children's Place. And because of that, we have seen an increase in the number of children who are cared for by their grandparents coming here to give them respite care. They can't afford it. We are fortunate to have good donations for an internal scholarship program because these grandparents don't work. They're not entitled to the child care scholarship through the state. And we want them to be safe. We want them to be healthy. We want them to be able to take care of themselves so they can take care of the children. So we're using those funds to bring the children in, which doesn't help us bring in more funds. So it's a huge catch-22, but we need to be able to serve the children. We need to be able to serve all of the families. We're seeing a lot of children with stress. We're seeing a high number of food insecurity in our families right now, more and more family issues. We're seeing more children through the Navigator program, more grandparents coming in due to an increase in addiction in their own families during this time. So I had an average caseload of about 7 or 8 kinship families prior to COVID. I'm at 21 right now.
Wow.
Yeah, and there's big problems there. Our Kinship Navigator funds run through June of 2021. I have $300 left in my line item for concrete supports for families. It's been, the last 2 months have just been people in desperate need that we've had to help with food, with utility bills, with paying some of their rent, you name it, car repairs, so they could get what they need, and helping to pay for medication for some of the grandparents as well. So,
Mary Lou, I'm so sorry to interrupt. We have only a few minutes left, and I'm hoping we can get to the remaining 2 folks on the call. Is there a final thought you have to share before we move on to those last 2 folks?
no, other than thank you for the work you're doing, and
Thank you.
as always, we love you.
Thank you so much, Mary Lou. And we have 2 folks left. We have only a few minutes, so thank you all so much for your patience. And next we have David Ports with the Granite YMCA.
Hi, David.
Hi, Senator. Thank you so much for inviting us to be on the call, and thank you for being a champion for our childcare work as well as all of our not-for-profits. We really appreciate it. I'm just going to focus on 3 things only. The first one is a recognition that with all of the reduced enrollment, the YMCA is at 43% of our pre-COVID enrollment. The volatility on top of that, of the being able to deliver these services is of course really disruptive in our ability to care for children who really need it. So this stabilization work that you're doing, the fund that's being proposed, is very critical, and we thank you. As a larger organization, we also thank you for your focus on expanding the eligibility of the PPP loan so that organizations like mine that have more than 500 employees can take advantage of that. You know, our child care program is one part of what we do, but those kids also participate in a lot of the other things that we do, from swimming lessons to day camp, and we really need to be able to provide those services. And the last thing is that I would say that we need to look to the future too. As Chris had talked about a little bit before, we know that our culture is finally realizing that we have, that childcare is as important as education in helping kids develop to their fullest potential. And we need to be able to take a look at how can we expand access to really good childcare that works in alignment with our schools and our families, so that we can make sure our kids get to, can contribute as adults and develop to their fullest. All of us on this call will help you as you continue to champion that work and that vision. Thank you so much for all that you do.
Well, thanks very much, David. I should have pointed out that in addition to the money that we're hoping to get to go directly to childcare, we also are reauthorizing the PPP program and some of the small business programs that are designed to also help nonprofits. Sadly, I don't think we're going to be able to get the employee number above 500. I think we've had to lower it because of the limitation on the funds that are available. Now I'm hoping we're going to be able to revisit it come the new year. The challenge is we were able to get that increase in the HEROES Act that came out of the House, but it's been more difficult in the Senate, where the majority has not been willing to support that.
Thank you. I appreciate that.
Yeah, I'm sorry to report that news because I had, like you, I had hoped we were going to get there.
Well, keep up the good fight, and we're here to help.
Thanks.
Thank you, David. And last but not least, we have Rebecca Wojtkowski from New Futures.
Hi, thank you
Hi,
so much
Rebecca.
for your last minute. I just want to say my son is right next to me. So to emphasize, I'm one of
Good.
those women who have been working for 9 months with both of my kids at home. As Christina indicated in the chat, it's a mix of why haven't my kids returned? E-learning with my daughter, concern about safety given health issues with both of my children. I also want to emphasize what Chris Emmond said and David just said. This is long-term solutions. Please reach out when we think about how we can bolster access for all families. We're going to be in a reality where women have been devastated with regard to the workforce on the impacts of COVID. How do we get kids back to childcare centers, even if parents aren't both working? As Mary Lou indicated, our grand families and other families are in crisis and need relief and respite care. And we know that access to high quality childcare is so important for lifelong health of our children. So I just want to emphasize a huge thank you, but also partnership. This is a long-term plan about how we bolster childcare as a public good and see it for what it really is in this country.
Well, thank you. I totally agree with that. And as I think I think it was you, Anne, who pointed out that because of this crisis, hopefully this will be an opportunity for us to take a look at the importance of quality early learning, which includes, of course, childcare, and the importance of that. You know, I remember back when I was governor and we were trying to expand public kindergarten, somebody pointed out to me that children may only be 20% of our population, but they're 100% of our future. And we just have to keep reminding everybody about that. And I think one hopeful sign is that businesses, as they're thinking about how do they bring workers back once we get on the other side of the pandemic, are beginning to really understand just how important childcare is in ensuring that people can come back to work and feel comfortable about where their kids are. So thank you to all of you for everything that you're doing. We will continue to fight for you here in Washington. I hope we're going to see some relief very soon, and we will keep at it. I know you will do the same. And I hope you will share with, Chris Scott, who's on the call in Madison, of course, and Sarah and Erica is our person in Washington who is working on these issues. So please share with us any data reports that you have, because that does help us make the case. And if you have particular concerns or questions, if we don't have the answers, we will try and find out. So again, thank you all so much. Happy holidays to everybody. I probably won't see you before the holidays, so I know it's going to be a tough time for a lot of people, and really appreciate what you're doing. Thank you.
Thanks, everyone.
Thanks.
Thank you.